Anorexia nervosa is a common eating disorder and probably one of the most famous in the world. Here's how you can tell if you have anorexia nervosa based on the DSM-5 criteria. Criterion A, you restrict your eating to the point where you have significantly low energy intake for your body size and your age. Criterion B, you have an intense fear of gaining weight or becoming fat, or you have persistent behaviors that get in the way of you gaining weight. Criterion C, you're really bothered and fixated on your body weight. You believe that it's closely tied to your sense of self and your self-worth as an individual. Now, there are specific types. The restriction type means that there is no binge eating during that period. The binge eating and purging type means that you've regularly engaged in binging and purging. And again, the period is 3 months. The behaviors can't be better explained by a medical condition or another psychiatric condition or a substance. These are purely related to anorexia nervosa. Now, there are many different treatments for anorexia nervosa: group therapy, individual therapy, and many times medications are used. Now, the medications are usually added on to support the individual because they have co-occurring depression. So you may have an antidepressant in place. Many times people with anorexia nervosa also have OCD, obsessive compulsive disorder. So a lot of times medications will be used for that. And in some cases, people have insomnia and a lot of anxiety. So a lot of anti-anxiety medications may be used. Sometimes antipsychotics are used as well because they may help with some of the mood lability and also improve appetite. Anorexia nervosa has one of the highest rates of mortality of medical conditions in the psychiatric realm. People who restrict their eating may be at risk for heart rhythm issues, which may lead them to have high cardiac death. There are also medical conditions that may travel, such as osteoporosis and bone brittleness that leads to bone fractures, and also electrolyte abnormalities, vitamin deficiencies. So it's a condition that needs to be taken very seriously, and you may need to have a team of medical doctors and psychiatric providers to help you to get physically and mentally well during periods of anorexia nervosa. There's a lot of shame and isolation that occurs with anorexia nervosa. So a lot of the treatment programs have a group type of component so that people feel supported and they feel seen and validated in a group setting. Did you learn something new about anorexia nervosa? Please share that in the comments below.